the sexually transmitted infections for diseases. We'll talk about several bacteria, and we'll talk about some viruses, and then fungi and protozoa, all of which can be sexually transmitted. Bacterium that causes the disease syphilis is the organism Treponema pallidum. This is our second organism that we've discussed recently that has never been grown in the lab. Last lecture we talked about one of the mycobacteria, Mycobacterium lepori, that hasn't been cultured, and then also this organism. The sexually transmitted infections, particularly syphilis, gonorrhea, and chlamydia, all bacteria, have the same mode of transmission, the same risk factors, so it's not uncommon to have more than one organism transmitted at the same time from an infected individual. Infected women during pregnancy can transmit the organism to the fetus. Because it is a bacterium, it can be treated with antibiotics, but the earlier it's diagnosed, the more effective that treatment will be. The organism is a spirochete. It is a multiple wavelength helical shaped organism. The infection that it causes, the primary lesion called a chancre, will have a open lesion with serous fluid, and that fluid can be filled with these spirochetes. That's the chancre, the lesion that is associated with some cases, not all, but this is the form that makes it more readily diagnosed than an individual with a large open lesion. These have been described as being painless. I have no idea how a lesion like that can be painless, but I suspect the organism actually affects not only the tissue but the nerves and causes that sort of appearance. This will appear usually within a relatively short period of time post-infection. If the primary disease isn't treated, then the organism can move from the primary site of infection to other parts of the body, the mucosa of the mouth, and then ultimately to the third stage, to the central nervous system. Prevention, like all sexually transmitted diseases, by safer sex practices, monogamous relationships, abstinence, etc. And then, because it is a bacterium, again, antimicrobial therapy can be effective, although, again, diagnosis early makes the antibiotic therapy much more effective. Our second bacterium, Neisseria gonorrhea, we talked about another Neisseria when we talked about meningitis and central nervous system infections, Neisseria meningitidis. They're in the same genus, so organisms in the same genus have the same general characteristics. So they're gram-negative diplococci. They have the same gram reaction and microscopic morphology. You can see here that there are clusters inside neutrophils, white blood cells, that is characteristic of an infection with this organism. In males, urethral discharge containing white blood cells with intracellular gram-negative diplococci is essentially diagnostic, as you can do a gram stain and identify the organism. The organism does not survive well outside the host, so it makes it difficult to diagnose the disease, at least using older technologies. Since the organism doesn't survive well, you've got to get it planted onto agar media relatively soon after collection. If that doesn't happen, moisture availability, temperature, all affect the survival of the organism, and it can die relatively quickly. One of the problems here up until about 10 or 15 years ago was that from a public health standpoint, specimens that were collected in remote public health clinics and then shipped to a central, typically a state public health laboratory, the organism did not survive well and your recovery was variable. We've since moved our laboratory diagnosis from culture-based diagnosis to molecular detection. So we'll take a sample typically collected for dual testing for both gonorrhea and another organism that we'll talk about here in just a minute, chlamydia trachomatis. So we test for both of those organisms from a single sample by molecular tests using unique molecular probes that identify the unique gene sequences of those organisms. The organism doesn't have to be viable to be detected by those molecular methods. So transport, whether the organism is alive or dead, it doesn't matter by the time it reaches the laboratory as long as the nucleic acid is intact. And in fact, DNA will stay intact for some period of time after the organism has died. In fact, with our molecular tests, when patients have been treated, we can still have positive tests for 2 or 3 weeks after the patient's been treated with antibiotics because of the residual nucleic acid in that specimen site. Antibiotic resistance has become an issue with this organism. We talked about Staph aureus and the emergence of resistance with enzyme-mediated inactivation of penicillin, the beta-lactamase enzyme. That resistance mechanism made its way from Staph aureus to Neisseria gonorrhea. And then that figure that I was so exercised about here last lecture, that point in time where the prevalence of Neisseria gonorrhea increased was associated with the acquisition of that resistance mechanism, that beta-lactamase characteristic. Symptoms develop relatively soon after exposure. The challenge is there can be asymptomatic infection in both males and females. In males, urethritis, painful urination, burning discharge. In women, similar sorts of characteristics, although in women there is a higher percentage of asymptomatic infections. Again, the same modes of transmission, barrier precautions, abstinence, monogamy, etc. Again, penicillin resistance due to beta-lactamase, and then the variety of antibiotics besides penicillin can be effective. The infection of woman during pregnancy can transmit the organism to the fetus during delivery, during vaginal delivery. If the organism is in the vaginal mucosa, either aspiration or contact in the eyes can cause either pneumonia or conjunctivitis eye infection caused by that organism. One of the reasons that newborn infants receive eye drops is because of these sexually transmitted agents to prevent that ocular infection. Our third bacterium that is a common cause of sexually transmitted disease, and in fact, chlamydia trachomatis is the most common bacterial cause of sexually transmitted disease currently. Prevalence somewhere between 3 and 8% depending on the population. Here in Pierce County, we're somewhere between 4 and 6% depending on the population. Gonorrhea is somewhere between 1 and 2%.
In Pierce County?
Yeah, by far and away, this organism is in all settings is more prevalent than gonorrhea. Again, another bacterium transmitted by sexual contact. The characteristic of chlamydia we alluded to in the respiratory infections is that as a genus they are all adapted to an intracellular lifestyle. So they have a form that is extracellular, but it is not metabolically active. It is the infectious form. It is called an elementary body. Once that elementary body finds a host cell that it then infects, moves into that cell. It's a gram-negative organism. It has a cell wall, membrane, ribosomes, chromosome. So it is a typical bacterium, but it is adapted to living inside a eukaryotic cell. So it's what we call an obligate intracellular pathogen of bacteria. Symptoms, a little bit longer incubation period than gonorrhea. Discharge, pain associated with infection. In women, similar, painful urination, discharge. But again, asymptomatic infections. And the issue with women and sexually transmitted diseases is that because of the significant percentage, in some cases up to a third of infections with either gonorrhea or chlamydia are asymptomatic. Without symptoms, there's no treatment sought, and if those infections go untreated, it moves from the vaginal vault. Typically, chlamydia will infect the epithelial cells around the cervical os and then move up the fallopian tubes, infect the epithelial cells in what we call an ascending infection. And as it grows in those cells, can cause scarring as a result of the infection, and tubal scarring can then lead to infertility, ectopic pregnancies, etc. So it is the reason for the CDC recommendations for annual screening of sexually active women is because of the high percentage of asymptomatic infections. To identify those early to prevent untreated infections then that would cause those severe consequences if the infection wasn't identified. Associated with that ascending infection is a syndrome called pelvic inflammatory disease. It can be caused by chlamydia, it can be caused by gonorrhea, a combination of those organisms as it moves up the respiratory tract. Talked about the two different forms, the elementary body, the extracellular, and then the form inside the cell. In untreated women, again, ascending infections from the cervix to the fallopian tubes and uterus, resulting in sterility, pelvic inflammatory disease. Same prevention methods, barrier precautions, abstinence, monogamy, etc. Annual treatment coinciding with collection of specimens for, in the past, what used to be just pap smears. There's now another diagnostic algorithm associated with that we'll talk about in just a minute, because there is a virus that is also sexually transmitted that is diagnosed with examination